We are going to be continue on chapter 15, postpartum psychological adaptations. Give me a sec.
All right, let's talk about the psychological adaptations for mom. This can be all over the place, right? So a client's emotional and physical condition, think like unwanted pregnancy or adolescent pregnancy, any history of depression or difficult pregnancy or birth,
Support.
and then the newborn's physical condition,
that's good.
prematurity, congenital anomalies, just that fetal personality or that fetal disposition after birth can definitely affect the family's bonding process. Culture, age, and socioeconomic status are also factors that affect the bonding process. So attachment is a formation of a relationship between their newborn and the process of physical and emotional interactions. Most research.
Okay. So attachment versus bonding. So attachment is a two-way relationship between a child and another person, while bonding is a one-way relationship between a parent and their child. Attachment is a process that usually develops during a child's first year of life. Bonding is the parent's sense of connection to their child, and it's influenced by experiences during pregnancy and delivery. So bonding focuses on the parent's feelings, thoughts, and actions towards their child, including affective, cognitive, and behavioral manifestations. Bonding helps babies grow mentally and physically, and it sets an example for future relationships. Through bonding, babies learn about communication, empathy, and how to read social cues. Okay, we got that.
Most research findings stress the importance of early contact between the partner and the newborn, as well as participation in infant care activities to foster that relationship. So early and sustained contact between newborn and parents is vital. Even if, there's a lot of attention on mom at the beginning and the skin to skin and breastfeeding. Even if mom isn't available, let's say it's a C-section, can really try to involve the father or the partner in that process to help them to increase the bonding. When we talk about skin to skin, we also encourage skin to skin with the partner, with anybody who's going to be spending a lot of time with the baby or who wants that bonding relationship with the baby. We encourage that skin to skin. So nurses really just play a vital role in promoting this attachment. It's a great time to teach them, to show them, to help them to be comfortable with their baby and to show them what to do. Let's see, sorry, I'm on the wrong page here. Real quick, I did write this down. I think this is important because sometimes you don't know what you don't know, but cues for insufficient bonding. So things that you should probably be alerted to, or like red flags would be if there's apathy when the infant cries, if they don't really pay attention or try to nurture or try to care about that, when there's disgust when the infant voids, stools, or spits up, when the family member, the parent, turns away from the infant or ignores the infant entirely, if they perceive the infant behavior as being uncooperative, or if they express any disappointment to the infant. Those would be kind of red flags. They seem obvious, but sometimes when you see the situations, you're like, that's not how I would react. It's not a quick judgment, but it's more or less, I'm just going to keep an eye on this. Some patients are extremely tired. Some cultures just kind of start to turn inward and help take care of themselves before they take care of their infant. So there's lots of different things. And as a nurse, you're just kind of keeping your eyes open and being aware of what's going on. So postpartum mood disorders. This is one of the most common complications to occur during the postpartum period. And it can impair your maternal caregiving skills. So baby blues is mild depression, like a mild depressive symptoms. anxiety, irritability, mood swings, tearfulness, and just increased sensitivity and just fatigue. This typically will peak around 4 to 5 days and resolves up to day 10. About 85% of new mothers suffer from a short-lived postpartum depression. It's kind of termed baby blues. And then postpartum depression and psychosis are two different things. I mean, are different than just your baby blues. Postpartum depression will last longer. They're usually more severe than baby blues. Sometimes it requires treatment. There's not a lot out there still, even now, with this increased push for mental health. There's still not a ton that we talk about postpartum depression. So it's really common. It's common. There's more than 3 million U.S. cases per year. Usually it will resolve within a few months. It does need an official medical diagnosis. But some common postpartum depression symptoms are feeling sad or a low mood. They have a lack of enjoyment or a loss of interest. They lack energy. They're feeling tired all the time. They have trouble sleeping at night, and they feel sleepy during the day. They're finding it difficult to keep up, to look after themselves or their baby. This is hard because these are kind of all commons of just being tired, of being sleep deprived. And so that's why there's this unknown area. And, do you do treatment? Do you not do treatment? Is it severe? Is it not severe? Severe would be postpartum psychosis. So this is the most severe part of it. This is extreme confusion, paranoia, delusions, disorganized thought process, hallucinations. This definitely requires counseling, medication, sometimes even hospitalization. Postpartum psychosis can lead to poor bonding, can lead to violent thoughts or actions to the baby, to themselves, and alienation from their loved ones, and just overall daily dysfunction. So as part of your care plan, you'll be doing like a Edinburgh postnatal depression scale, a screening tool that's used. I think there's 10 questions on it, and it just kind of screens for postpartum depression. A lot of women in the hospital won't necessarily feel this baby blues or feel the depression yet, so I often tell them, these are things to be looking for in the next few weeks, right? These are kind of things that will show us that these are red flags and that you should probably talk to your doctor.
Okay, so a 28-year-old prima paris, so first time being pregnant, woman delivers a healthy baby girl vaginally. 3 days postpartum, the nurse assesses the patient and finds her tearful and withdrawn. The patient reports feeling overwhelmed and expressing difficulty bonding with her newborn. She denies suicidal or homicidal ideation. Which of the following is the nurse's priority nursing intervention? Is it to encourage the patient to spend more time alone to get much needed rest, educate the patient about the benefits of breastfeeding, conduct a standardized screening tool for postpartum depression, or provide reassurance and validate the patient's feelings? I'm just going to say validate the patient's feelings. So let me just see what. It's incorrect. So it says to conduct a standardized screening tool for postpartum depression.
There's a lot of variables that influence maternal role attainment. One of it is just confidence in your ability to be a mom or to take care of a baby, a patient's age, their own relationship with their father, their socioeconomic status, their birth experience. If there was a traumatic birth experience, it really is hard. It's just like any kind of trauma that you've experienced. It can take a lot of healing. It's hard for a lot of people, and so sometimes they'll reflect that into the baby too, right? That baby did that to them, and so it can affect bonding. You can read all these here, but these will all kind of affect the just that maternal role attainment. And then the infant, the appearance of the infant, if there's any kind of birth defects, if it looks different than what they were expecting, that can influence bonding and just that maternal role. The infant's temperament, their health status, and their responsiveness. Your book talks about this Reva Rubin's 3 phases of adaptation, so psychological adaptation. The first phase is dependent, like taking in phase. So this is the time immediately after birth when the clients needs others to meet their needs and to relieve the birth process. This is when the client takes a little bit more of a passive role in meeting their own basic needs. So this is typically around the first 3 days. This is when the mother focuses on their own needs like sleep and rest and pain control. And it's important for the nurse to listen and to help the mother interpret the events of delivery to make them more meaningful and more important. Another way of explaining it is to allow them to tell their story of delivery. Allow them to share their birth story. This might not be the best time to do teaching because patients usually feel overwhelmed or sleep deprived. But unfortunately, this is the first 3 days after birth. This is the only time that we have them in the hospital. The next phase is...
Okay, so phase 1, taking in, length can vary. Huh? What are you talking about? Taking in phase. Time immediately after birth when the client needs others to meet her needs and relives the birth process. Okay, so taking in phase, this is the Reva Rubin's 3 phases: the taking in phase, the taking hold phase, and the letting go phase. So the taking in phase, like, what the fuck just happened, bitch? Did you just see what the fuck happened, bitch? I just gave birth to this big ass fucking baby. So taking it in, god damn. Taking hold is second phase, characterized by dependent and independent material. So like, oh my god, like I really have this child. Taking hold of that. And then letting go phase, the third phase, in which women's reestablish relationships with others. Like, okay, cool, I can do this, and I have all these other people with me. Okay, Phase 1, taking in, length can vary, focuses on the mother's needs and recovery, okay? New mothers are often dependent on others for support with physical needs like sleep and eating, and they may be highly talkative about their birth experience. Emotions can be varied with highs of joy and lows of exhaustion.
This phase is the taking hold phase. This is a dependent-independent phase. This is when you'll see the parent striving for more independence. You'll see the client really beginning to assume the task of mothering. They're learning the ropes. They're kind of figuring out what to do. This would be your optimal time to do patient teaching.
Okay, so maternal psychological adaptation. What are we talking about? Second phase, taking hold phase. And the mother focus shifts towards the baby's care. Okay, her care and then the baby's care, and developed competence as a caregiver. They begin taking charge of tasks like feeding and diaper changes, and a desire for routine and organization often emerges, and the mother still needs support and validation from her partner and family.
And then the letting go phase. This is interdependent. This is the third phase in which the parent reestablishes the relationship with others. You'll observe a mother's feeling like a deep loss over the separation of their baby, right? So when they go back to work, or maybe they do their first girls' night out, they feel weird. They feel it's a different feeling, and so they start to feel a little bit of a separation or a little bit of a loss. Sometimes they even grieve that loss. And some moms feel really caught between the dependent and the independent roles of wanting to feel safe and secure, yet wanting to make decisions for themselves and be themselves. Again, really think about teen moms here, and think about that conflict taking place within them, being a new mother, but also still being an adolescent, and her peer group is still definitely adolescence. So this can be difficult for an adolescent mom.
Yep. Okay, last phase, letting go. So this phase is about integrating motherhood into the mother's existing identity. She begins to establish a sense of self alongside her role as a mother. There's a stronger emotional connection with the baby, and the mother feels more confident and capable in her parenting skills.
Your book also talks about a BAM theory, so the 4 stages of becoming a mother. There's the commitment and attachment to the unborn baby. This happens before the delivery, just committing to it, and you start to grow attached to that baby growing inside of you and feel bonded to them. Then there's the acquaintance attachment to the infant. This is the phase where they're learning to take care of their infant, where there's a physical restoration of their body. There's a lot of learning that happens here. It can feel really overwhelming and exhausting. There's not a book that's clear-cut of this is the way that we do it, so it can be kind of overwhelming. And there's lots of opinions and lots of advice, so that can overwhelm new parents also. People during this phase will think, how am I ever going to go back to work? How am I going to leave them? How do I get anything done? Like, how do I live my pre-life? How do people do this type of thing? The third stage is beginning to move toward a new normal. This is when parents really begin to find their groove. This is when they've figured out that things aren't quite as overwhelming as they felt earlier in the first month or 2 months after delivery. And this is just where they start to expect and prepare for things, right? Like they're going to have the diaper bag. They're going to be prepared for the poop explosions and for things like that. So they're moving just toward a new normal. And then the last one was the achievement phase. And this is just the maternal identity. They're redefining themselves to incorporate motherhood into them and their new role and their new life. This is typically around 4 months. 4 months is when things kind of start to calm down and you're like, okay, I'm starting to understand and figure this out, and kind of identify themselves as a mother. As for engrossment, engrossment is characterized by 7 behaviors. It's really something that's pretty fun and amazing to watch during delivery.
What is that?
You can pick up on some of these during deliveries, especially a lot of the students, and myself included. It's always fun to see a father of the baby who's just really excited and engrossed and involved and very present. But these 7 phases would be visual awareness of the newborn, tactile awareness of the newborns, when the parents are looking closely and touching and making sure they have all their fingers and toes and, commenting, oh, they have your eyes or they have this. They have a perception of the newborn as perfect. Usually when you work in labor delivery, you recognize there aren't really a lot of cute babies when they're newborns, right? They get to a cute phase, but a lot of newborns aren't all that cute, but the parents just think they're cute, right? So I'll have to tell you the story of my first baby. And then maybe I'll bring a picture in. And then there's a strong attraction to the newborn. There's an awareness of the distinct features. And this is where they kind of go through, oh, she has your nose, or she has your chin, or whatever. There's extreme elation by the father. This is definitely probably one of the funnest things to see. And it's when the dads, a lot of times too, the dads get that first interaction. I mean, we could put baby to mom's chest and they have that interaction, but when we take the baby over to the warmer to clean and dry and to do vitals and assessment, that father will get that first interaction, which is really kind of cute. And then just an increased self-esteem, feeling very proud of the fact that they've accomplished bringing a baby to the world. It's important for the nurse to promote this bonding, to build the confidence with the parents, to encourage skin to skin, to encourage diapers and swaddles and kind of teaching them everything like that. It's also important to include the kids in this phase. Sometimes we'll make the siblings feel really important, give them a little ice cream or give them a tour of the unit. I know at St. Rose, they have little buttons that say first time sister, or big sister, or whatever, things like that.
Don't mind me printing my
Just
color
a cute
by
picture
number.
of the dad. And then I love this. So I think I just had a baby also. I've had my babies with Princess Kate around the same times, which is never a great idea. But you just want to kind of talk about expectations versus reality, right? So, this picture, it just makes me giggle every time. So expectations, this is where the preconceptions of what it will be like now become a reality. So with social media, everything can look perfect, and the hair is done, the makeup's done, and then in reality, labor is long, and moms are sweaty and swollen and exhausted, and they have messed up hair, and they're just a hot mess, right? But we don't often post pictures like that on social media, so people don't see that part of it. So we just kind of want to talk them through what is reality, and then we start to transition to mastery, and this is where the partner makes a conscious decision to take control and to be part of the newborn's life and to find their role as a family unit. Culture is a huge thing in labor and delivery, especially when the baby comes out. So cultures will vary in their postpartum beliefs and their practices and their customs. Some cultures don't feel comfortable breastfeeding in the hospital. Then they go home and are very successful at breastfeeding. Some cultures only want a female physician. Some cultures believe in immediate postpartum restoration. So like the Korean moms will be shoving in kimchi to their Korean daughter who just had a baby. So lots of cool things that we get to see in different beliefs. So nurses need to be open and respectful, non-judgmental, and just willing to learn about ethnically diverse populations. And then understanding various cultural views of the postnatal period as it relates to the recovery. We've got to be respectful. And if it's something that's unsafe, like I know some Indian cultures will want to give honey, we know that can cause botulism. So there's certain education things that we have to bring up. But for the greater majority, we can just learn and appreciate and grow from these different cultures and their postpartum practices and beliefs.
Honey right off the bat, huh?